Good morning, everyone. Respected chairperson, moderators, and thank you, APO, for giving this opportunity. I'll be talking on low-cost, affordable eye care and blindness control through community outreach, Haryana. The magnitude, which is that is more than 2.2 billion people, they have visual impairment globally, and out of which 1 million is preventable. But the sad state of affairs is that 36% of these people with impairment due to refractive errors and 17% with cataract, they have received access to the appropriate intervention. And as a result, this impairment poses a global burden of US dollars 411 billions. And this affects usually more than the age of the people, age of 50 years. And again, the sad state of affairs is in our low and middle income regions, which is about 4 times higher than in the high income regions. The goals and objectives of NPCB, which is being followed by Haryana for community outreach program, and for which I would say I'm grateful to Chand Singh sir, Dhul sir, that when I was a postgraduate student at RIO PGMS, was the head. And we had great opportunity to learn and implement these community outreach programs under the leadership of Chand Singh Dhul sir. So their main objective is to reduce the backlog of blindness, to develop and strengthen the strategies of NPCB, that is the eye health and prevention of visual impairment, to enhance the community awareness, to increase and expand the search for the prevention of these blindness causes, and to secure more participation of the voluntary organizations and the private practitioners. The major causes of blindness in Haryana are cataract, refractive errors, glaucoma, corneal opacity, trauma, and vitamin A deficiency. Also, all the districts in Haryana, they have been sensitized for the newer components like diabetic retinopathy, childhood blindness, glaucoma, vitreoretinal surgeries. Again, why do we need these outreach programs? As we know that as more early is the age, that leads to the delayed motor, language, emotional, social, and cognitive development, which is lifelong consequences, which later on affects the quality of life also. So, we need early detection and timely treatment. As we know that the diabetic retinopathy, glaucoma, they are most crucial to avoid the irreversible vision loss. And it's so easy, like the spectacle correction for the refractive error and the surgery for the cataract surgery, but the sad state is that only 36%, as already discussed, with these refractive errors, and 17% of with cataract, they have access to the quality. So WHO response for this is that the guidance by the recommendations of the WHO World Report of Vision 2019 and resolution on the integrated people-centered eye care, which includes preventable blindness and the visual impairment. It has been adopted at the World Health Assembly in 2020. Its key proposal is to make the integrated people-centric eye care and to ensure its widespread implementation. Some of the WHO's key areas of work and activities in the prevention of blindness are, that is working with the member states and other partners in the field to monitor the global targets for 2030 on IPC, to develop reports of coverage of eye care indicators to monitor the progress, and to develop resources and technical tools to support the integration of eye care into the health information system. Measures which have been are of use are the World Sight Day, which is an annual advocacy event. We are supporting the integration of eye care in healthcare systems through the implementation of a series of technical tools like the eye care in the health system, that is a guide for the actions, the package of eye care interventions, the eye care competency framework. Now, the development and implementation tools to support the countries to assess the provision of eye care. These tools, they have been very helpful. That is the eye care situation analysis tool, the tool for the assessment of diabetic retinopathy and management, tool for the assessment of glaucoma services, tools for the assessment of refractive services, and the tool for the assessment of rehabilitation services. Various materials and resources have been developed to raise the awareness, that is like the Myopia Aid, which is a mobile health toolkit for myopia to increase the health literacy, a population-facing app for near and distance visual acuity testing, graphics which promote the healthy eye habits. Like in our institution, every year, like during the World Glaucoma Week or during the World Diabetes Awareness Week, we organize the rural and the outreach programs, which are cornerstones in the prevention and screening and prevention of the blindness. This camp was organized last year where 825 patients were screened, and this year again it was organized during the glaucoma awareness week. So this way we are doing the outreach programs in Haryana to increase the awareness and prevention of blindness in the various districts of Haryana. Thank you.
Thank you. This is basically a true model of spoke and hub. So the government, as Dr. Hiteshi has told, that what the government is doing, and now the second wheel, that is the government medical college is doing. So